Chronic kidney disease among the youth is said to be on the increase in Ghana. According to renal experts, most patients on dialysis in Ghana are under 40 years. The figure, according to the head of the renal unit at the Korle Teaching Hospital, Dr. Vincent Biomah, has the potential to increase exponentially if individuals and the government do not adopt the necessary precautionary measures to slow down the rate of disease progression. Gifty Adjei has more in this report.
Meet 27-year-old Kweku Kwatin, 29-year-old Christina Afo, and Mercy, who's 28. They are all living with end-stage kidney disease.
I'm 27. Immediately I completed the SHS around 2016. I personally went to clinic to go and do checkup. So the time I went there, my blood pressure was high. And they went to do some lab tests and those stuff, and they saw that my urea and then creatinine is a little high. So they referred me to Accra.
Feeling some headache, like it was a frequent headache. Where I work, there's a clinic there. So when I went there, they checked the BP. Like it's almost every day, the BP is very high. So the doctor asked me to run some labs. I did the lab and brought it, but he said he didn't believe it because at my age, I shouldn't be getting something like this. So I ran, and he gave me another one to do it in a different place, and I went to do it. When I brought it, it was really the same. Yeah, so he told me that I'm having a renal dysfunction.
I'm 28. I started around 2016. Before I went to the hospital, I was seeing blur, and then kind of feeling dizzy. So I went to polyclinic. So through some tests, I was asked to come to Korle because there was something wrong with my kidney. But they didn't specify the amount of how damaged it was.
Dr. Vincent Biomah is the head of the dialysis unit at the Korle Teaching Hospital and explains some possible causes of end-stage kidney disease.
We need to understand that the black race is predisposed to getting kidney disease. There are genes that have been discovered, especially in West Africa. And there are other environmental risk factors. The commonest, of course, is hypertension in our part of the world. Hypertension is so prevalent in urban centers. Hypertension rates or prevalence rates are as high as almost 48% to 50% in urban areas. Diabetes is on the increase as well, and it's increased manifold over the years from many decades now until now, and it's been estimated to increase almost by 160% by the year 2024 in our sub-region. Knowing that diabetes is the #1 cause of kidney disease globally, if this truly happens, then the burden of kidney disease is going to increase even further.
Irregular visits to the dialysis unit cost about 500 Ghana cedis per session, which usually lasts for about 4 hours. But a patient will have to visit the hospital 3 times in a week and could be paying up to 6,000 Ghana cedis a month for the blood purifying treatment. Unfortunately, the cost of dialysis treatment is not covered under the National Health Insurance Scheme.
It's very tough. I can say, like, only 3% of people can do it.
Sometimes you come and you would have to stay over till the following day before it will get to your turn to dialyze. The doctors are saying with this condition, you won't be able to give birth. Even when you carry the child, it's going to be a lot of, my health is important to me.
For these 5 years, it's not easy because it's costive, and then even the pain, the torture you go through on the machine, it's not easy.
According to patients of end-stage kidney disease and their families, the disease is so painful that there have been occasions they thought they had been cursed or the disease had some spiritual twist. However, numerous visits to some spiritual men could not avert their plight.
Maybe sure because na yet metebia Facebook ni ade na mtise kidney, but na minim say bi bebe mi say ntama sure bem.
Minim se ne yareba na kurate minim
Globally, some 850 million people are affected by kidney disease. In sub-Saharan Africa, the prevalence rate stands at 14%. According to health experts, Ghana's statistics could be double or thrice that of the sub-region. The head of the renal department says the current figures are likely to go up in the future, which may be triggered by unhealthy lifestyles.
In the early stages, kidney disease is largely silent, and therefore you don't wait until you develop symptoms before you go out checking for kidney disease. It would be too late. Not it might be, it would be too late, because you only start showing signs and symptoms of kidney disease when you have lost more than 75% of your kidney function.
The patients advised the public, especially the youth, to take critical care of their health.
The youth should take their health like very, very important. If I had checked it earlier, I wouldn't be here.
I can't have a stable job because everyone wants someone who will be consistent with their job.
For these patients, they have only two options available to them: a kidney transplant or forever live on the dialyzer.
Waste removal from the body is the major function of the kidneys. However, for the patients here, they might depend on the hemodialyzer for that function to be done. What the experts are calling for is for a constant adoption of healthy lifestyles. Reporting for GBC News, Gifty Adjei, Korle Teaching Hospital.